Health insurance section 3 is social insurance. So we talked about the acronym of OASDHI in the life insurance course. So if you're just doing health only, this is new to you. Old age, survivor, disability, and health insurance. So Social Security, basically, in an acronym form. HI is Medicare. So Medicare has parts, which I have introduced to you earlier. Parts A, B, C, and D. So you need to know that Medicare is part of Social Security. You need to know that it is available to persons that are age 65 and older. There are certain situations like kidney dialysis or a disabled widower that might qualify for early Medicare coverage, but generally we associate it with being age 65. Not something that your normal everyday college student would enroll in. So Medicare has to do with age. Part A covers hospital expenses. So Part A is the portion of coverage that has no premium. So I'm going to say free, meaning it has no premium. It is hospital coverage. Does it cover every single thing that might ever be needed in a hospital? No way. There's always gaps in Medicare. So maybe your client buys a Medicare supplement policy, or maybe instead they decide to enroll in the Medicare Advantage plan, which we'll get to here in just a moment. You do need to know that under Medicare Part A, the hospital coverage, you have coverage for skilled nursing home care. So skilled nursing care is the highest level of coverage that you might ever need. Skilled nursing care. In order to be eligible for skilled nursing coverage, the person must have been in the hospital a minimum of 3 days first. So this is a very limited skilled nursing care benefit. You must be going to the skilled nursing care to get better, not the other one. So there is this limited amount of coverage under Medicare Part A. That's generally going to be on your test. What kind of care? Skilled nursing care. Hospice care is there as well, though. The first 20 days of skilled nursing care are paid for by Medicare Part A, and then the next 80 days are subject to a copay. After 100 days, Medicare Part A does not cover skilled nursing care. We said there's no premium associated with Part A of Medicare. It does generally have a deductible and coinsurance, although it depends upon which portion of coverage applies. Medicare Part A hospital coverage does not cover private rooms. Nope, doesn't cover telephone calls or the first 3 pints of blood. So there's your deductible on your blood coverage. No coverage for your first 3 pints of blood. If you are eligible for Part A of Medicare and you work for an employer that has group medical expense coverage and the employer has less than 20 employees, Medicare coverage is primary. If you work at an employer, you're eligible for Medicare Part A, so you're 65 years or older. You're covered under medical expense at your work, and there are 20 or more employees, then your group coverage is primary. So basically what this is saying is if you work at a small employer, less than 20 employees, your small employer, when you turn 65, is going to be really happy because Medicare becomes primary, your group coverage becomes excess, and the premium that is tied to you, the person who just turned 65, goes down for the group significantly. In a large group, which is 20 or more employees for this definition, the group coverage is primary and Medicare is excess. Medicare Part B, physician services. So that's always a question. Covers doctors. It does have a premium so that you must enroll. If you want it, you must enroll. Covers doctors. So A, hospitals, B, doctors. The premium that's owed for your Medicare Part B is going to just come right out of your Social Security check. What's the earliest you can enroll as a general rule for Part B? Age 65. Medicare Part B covers clinical laboratory services in addition to your physician expenses, home health care, outpatient hospital treatment. So inpatient hospital, that would be Part A. Part B also covers blood transfusions. You do have a deductible and coinsurance for Part B. So Part B has a premium, has a deductible, and coinsurance. It's when you enrolled in the Part B that you started your 6-month open enrollment period to get any Medicare supplement that you wanted, which we previously discussed. Medicare Part C, these are the Advantage plans. So these are pretty popular. A lot of people get these. Advantage plans. It's like enrolling in the HMO for your coverage when you turn 65 years of age. So HMOs, a lot of HMOs have contracts with the federal government to provide these Advantage plans. PPOs do this as well. So when you enroll in an Advantage plan, it does, who offers them does vary by geographic area. So if you live in Colorado now and then you move to Arizona, you might have to switch your Advantage plan just because the HMO that you were in Colorado potentially won't be in Arizona. So the PPOs and the HMOs have contracted with the government, but they're geographic, generally speaking. In order to get Part C, you must have A and B of Medicare. Some Medicare Advantage plans have a premium and some do not. It depends upon which one you get. So there's lots of different ones that you can choose from. You don't need to submit any claims forms because it's like an HMO. You just go to the doctor. There's no claims forms. There's no reimbursement required. You would never need to buy a Medicare supplement policy if you had a Medicare Advantage plan. Medicare Part D. So this is the prescription drug coverage available to any person who's eligible for Medicare. Private insurance companies offer Plan Part D. So there's so many different private insurance companies offering these prescription drug coverages. So it's this idea that what Part D should you get? So prescription drugs, know that. It really depends upon what drugs are you taking. So if you have some specific drugs that you take, when you choose the Medicare Part D, you need to make sure to read the formulary. You need to make sure to read what it does cover to make sure that what you need coverage for is actually covered. So there's lots of different formularies that are out there depending upon where you get the coverage from. There is a premium, of course, for the prescription drug coverage, a deductible and coinsurance. Very oftentimes there's co-pays associated with them. You are allowed to switch your prescription drug plan once a year during the open enrollment period. Open enrollment is annually from November 15th to December 31st. It also applies to enrolling in Part C of Medicare. So the open enrollment period for switching your prescription drug coverage or enrolling in an Advantage plan. We talked about there's lots of gaps in Medicare. So, first 3 pints of blood weren't covered. So there's things that are not covered. What is not covered? Most self-administrable prescription drugs, routine physical exams. So in order to get prescription drug coverage, what do you have to buy? Which one do you have to get? Part what? D. So for many, many years, there was nothing you could buy to cover those. So we still talk about them being excluded prescription drugs unless you buy Part D. Routine physical exams are not covered. Routine eye exams are not covered. Eyeglasses are not covered. Dental care, dentures, anything you need when you get old, it's not covered. Hearing aids, routine hearing loss exams, not covered. Care outside the U.S. is not covered. except Canada and Mexico. There is care in Canada and Mexico. Routine foot care is not covered. A lot of diabetics have foot issues, and that's routine foot care is not covered. If you're concerned about gaps in Medicare coverage, buy a Medicare supplement policy. Buy a plan. There's those 10 standard plans. We mentioned them before. But remember, if someone has purchased a Medicare Advantage, which is Part C, we call them Medicare Advantage plans, but it is Part C of Medicare, they should never buy a Medicare supplement. Medicaid. Medicaid is health insurance for people based upon need. Medicaid. So it is health insurance based on financial need. Not based on age, has nothing to do with age, based on financial need. Another way that they might describe it, a medical assistance program. So be careful. When they use the term medical assistance program, they're describing Medicaid. They're not describing Medicare. Medicare is part of the Social Security system. So it's not describing medical assistance program is not describing Medicare. It's describing Medicaid. So it has to do with meeting, passing, failing, depending upon how you interpret this, having little to no assets, meeting the income to asset test. Has nothing to do with age. They're going to try to trick you. It's financed with both state and federal money. So a public medical assistance program for the medically needy who can't afford normal insurance coverage. It does cover custodial care in a nursing home. I did talk about a little bit of skilled nursing care coverage under Part A of Medicare, but that's very hard to get. So Medicaid, based upon having no assets, basically a little bit of income, you can get nursing home coverage, or you can buy long-term care insurance. Social Security benefits. So OASDHI. So health insurance, that was Medicare. There's a disability income benefit available. There's a survivor benefit, and there's your retirement benefit. So it's this long acronym. Generally speaking, if they give you the acronym on the test, they'll also give it to you in parentheses spelled out, old age, survivor, disability, health insurance. What is it? It's Social Security. How do you qualify for this disability income benefit under Social Security? It's really hard to do. To get the disability income benefit under Social Security, you must be unable to perform any job. So that's a very broad definition, and that's hard to meet, so you can't do anything. Your disability must be expected to last for at least 12 months, not 6. They're going to try to trick you. Or they expect you to die from your disability. When you do become totally disabled and they expect you to die from it, or you're going to be disabled for at least a year, there's a 5-month waiting period. So there's an elimination period on Social Security disability income for 5 months. You get nothing. Then if you're still totally disabled, you will get a disability benefit. How much will you get? Depends upon what's called your primary insurance amount. So your disability income benefit is based upon your primary insurance amount. You need to be what's called fully insured, which means that you need to have contributed to Social Security for at least 40 quarters, which is 10 years. And how much you get is based upon how long you've been into the system, how much you've paid in, how old are you when you need this benefit. So everybody has a different disability income benefit, a different retirement benefit, a different survivor benefit. Nobody gets a better Medicare. We're stuck with the same Medicare no matter what. So your benefits under Social Security are tied to the PIA, so tied to the recipient's primary insurance amount. That includes our discussion for social insurance. Read the key facts. Happy studies.